right. Well, hello, everyone. Welcome to today's podcast of Bridges to Community. My name is Sarah Turcott, and I am the Area Community Liaison for Bridges by Epic.
Well, hello, Sarah. I'm Erica Lab, Director of Team Member Engagement and Culture at Epic Senior Living, and we are thrilled to be back with today's episode. It's a little bit different this time. Sarah and I are going to talk about a topic that's of great interest and value to both of us. We do not have a guest for today. We're each other's guests. But today's topic is going to be proactive brain health, keeping your mind healthy as you age, and also your body, but really focusing on brain health.
No, I am so happy to talk about this topic, Erica. It is actually our most requested topic when we are out in the greater community. I think many families, seniors, adults are really into being proactive with their health. And, proactive brain health not just helps our memory, but many aspects of our entire body. So I'm excited to dive into the topic.
Me too. And both of us have presented this topic publicly. So some of you in the community watching or listening may have been to our trainings at the Council on Aging or senior centers, what have you. So a lot of it will be hopefully not entirely new, but if you haven't joined us before, hopefully you'll get some good takeaways and a couple things that you could start doing literally like this minute, like you drinking water.
Cheers.
Cheers with my afternoon coffee. Whoops. Anyway, so we're going to get right into it today. I'll take the first couple points. One of the generalizations like we want to kind of keep in mind is that aging and in general our health and wellness depend on a few things that we have control over and that we don't have control over. Our genetics, which we really have as far as I know, we do not have control over at this point in time. Our genetics, so biologically and physiologically, the genes that we were born with. Our environment, which can be a little bit of both. Those of us that are very lucky have a little more control over our environment, but still, it's a little bit of both. We have some control, but not total control. And then our lifestyle, and lifestyle is where more of our control comes into play. So positive lifestyle choices can help you maintain a healthy body and brain, and genetics, even though can sometimes be a barrier to good health, because we have control over things like environment and our lifestyle, we can offset some of the genetics predispositions.
And, I think we talk about proactive brain health so much at Bridges because we do solely focus on dementia care. And there is a huge correlation with proactive brain health and Alzheimer's disease. Alzheimer's is an abnormal accumulation of protein in the brain, resulting in plaques and tangles that cause progressive degeneration. And as you shared, age, genetics, lifestyle, these can all play a factor. And not only does brain health help our, overall memory and functioning, but when we are proactive, it can also help things like heart disease, high blood pressure, depression and diabetes. And we talk about ways we can proactively, look at these things to have an overall positive effect on our health.
Totally. And I often start these trainings that we do when we're sort of milling about. Sometimes we do it with lunch or something, and we're kind of talking. And it's like, really, when we think about wellness, so many of the things, like people will say, well, I'm really interested in heart health, or I'm really interested in brain health. And so many of the things, it's good for one thing, it's good for all the things. So really, that's the wonderful piece of this, is that you're getting, a lot of bang for the buck. So you make a lifestyle choice like drinking more water, that's really affecting all your systems functioning, your heart functioning, your cardiovascular system, your brain health, all is benefiting from that one habit change.
Absolutely. And small steps really do accumulate into bigger results. And, you know, one of the things we talk about brain health is because there are serious risks when we're not taking these into considerations. You know, there are some possible risks and threats to our brain health that some may be a little more obvious and some may not be. And sometimes, like you said, those little changes can make a big difference. And, you know, some of the threats and risks out there can be even medications that are being prescribed to you.
Yep.
You know, not one medication works for all. So certainly if you're taking medications and you start feeling foggy or just functioning different, it's worth talking with your doctor.
Totally. And that was one of the things, I think, on our last podcast, we talked about people's fear of talking to their doctor about memory changes or changes in general in your general health. But one of the benefits of doing that, it could just be a medication that needs to be tweaked or changed that could be causing, you know, whatever the distress is or whatever the change is. So by sharing that symptom, you're actually like opening up your doctor's like vision to see like what we could change.
Yeah. Where is this stemming from? Where is this stemming from?
Totally.
I mean, even things that you may not even think about could be affecting your brain health. Things like heart disease or diabetes. You know, there's other illnesses out there that can absolutely affect your brain health. And if we're not treating them, it can make things, you know, progress from bad to worse.
Totally. Other things. So other things that affect your brain health and, again, other systems is smoking. We kind of known that for a long time. Cigarette smoking, no bueno. Poor diet. So as we age, many of us maybe lose a partner, and so we spend less time on cooking and thinking about food. And so poor diet, lack of meeting your nutritional needs can be a risk to your brain health.
The amount of processed foods out there.
Processed foods, oh my gosh. Yeah, and we really, convenience foods, things that have made our lives easier have made us profoundly unhealthy, for sure. And then we've talked about this a lot in former podcasts, but the sleep deprivation and lack of good quality sleep. Lots of studies now showing the correlation between poor sleep and mild cognitive impairment and dementia, other forms of dementia.
And we can even dive into these topics a little more as we go through of why sleep is so beneficial. And not just sleep, but also physical activity. And it doesn't mean that you have to get up and run a marathon tomorrow. There are little things that we can incorporate into our day-to-day lives to get a little more active.
Yep.
And most especially with social opportunities.
Yeah. And community. And you think about the pandemic, when we were shut down, and everybody was isolated, and just the profound loneliness that is now, they say that is really endemic, is like this loneliness and lack of community, and where church communities or temple communities were so, 50, 60 years ago were imperative to well-being because you had your built-in community. We live in silos now and there's less community. We don't know our neighbors as well. And that has made our health really diminished because of that.
Absolutely. And, I know that the research and studies are still happening, but it will be very interesting to see what that data shows, the results of the pandemic and what that social isolation has done to so many.
Totally. I actually now that you mention it, I just read something yesterday that there was a huge increase in deaths from alcohol use disorders post-pandemic because of, the increase in use. We all sort of joked about it, like, oh, send the wine truck, but alcohol abuse and use disorders really grew during as a coping mechanism during the pandemic. And so, as you'd expect, the death rates due to alcohol also increased at a profound, I don't even remember the numbers. I should have grabbed them for this podcast, but you can Google it and find the studies that recently came out.
Yeah.
And people thought, well, this is going to be short term. It's a few weeks, and so you started grabbing the wine and trying to undo the social isolation by saying like, well, let's meet for a wine on Zoom.
Yeah.
And it turned into like an every night habit, unfortunately, for a lot of people. So, yeah.
Absolutely. So, we talk about all these things and, we're going to dive into each of these, but what can we really do to try to protect our brain health? Obviously trying to take care of our overall health. And as you shared, Erica, eating healthy foods, exercising your body.
Right.
There's so many different things that we can dive into that truly are going to benefit your brain health. Do you want to start off with our first suggestion?
Yes. Smoking.
Seeing your doctor.
See your doctor. we're sharing notes, but clearly not exactly. So make sure you visit your doctor. We want to talk with our healthcare provider, go over your medications, right? Am I on the right slide here? Yeah, thank you for cueing me, Sarah. Make sure the drugs you're taking. Sometimes a doctor will suggest B12. People have symptoms of memory loss. It could be a deficiency in B vitamins, specifically 12. They might look at, sometimes there's neuropathy medications in particular, like different medications that can affect memory. And so by looking, kind of pulling back and generally looking at your lifestyle, your genetics and your environment, the foods you ingest, your habits, they can sort of provide some counsel on what's working and what's not working. You want a provider that really listens. And some people, that's your doctor. It might be your nurse practitioner or PA who sees you instead of your doctor. But you really want someone that asks those questions like, what time do you go to bed at night? How well do you sleep? How many hours do you sleep? Do you feel rested?
Absolutely.
And does that thorough look?
Absolutely. And I mean, checking the numbers. I mean,
Right.
the once
The
a
markers.
year, the once a year physical, it does come usually with blood work. It is so important to look at those numbers because as in the world of dementia care that we live in, we know that there's reversible dementia and irreversible dementia.
Right.
So running those numbers and making sure your blood sugar is going well, your blood pressure is good, your cholesterol is good, those all affect your brain.
Right. Right. And so not just taking the blood and not having a conversation, everything should be a conversation. And so making sure your provider is doing that for you. Yeah.
So many people skip out like, oh, I'm
Right.
feeling okay. I don't think I can wait till next year. And it's a common thing. No one likes to go, but they can catch something early on, and early diagnosis for anything is key.
Yeah. I mean, even something as little as dehydration. Mm-hmm. A lot of people live in this mildly dehydrated state all the time as I sip my afternoon coffee. But I'm addicted. But just by increasing the amount of water that you drink, I remember my grandmother, I think I've mentioned this 1,000 times on this podcast, but like never wanted to drink water. And so it was like tea or diet soda or whatever it was, no water. And so would literally go to the hospital disoriented or not feeling well. And it was dehydration. And it's like, oh my gosh, it's so preventable. Absolutely. But if you're not attentive to it, you wouldn't even think. And then you have a UTI and that exacerbates memory loss and disorientation. So something as simple as like staying hydrated is so important. Just one little thing.
Well, we're like plants. We are 75% water.
We are, at least. My goodness. I'm 75% coffee, I think.
So, other things that we want to look at as we're trying to look at our overall health is our heart health and diabetes. These are factors that increase the risk of heart disease, but they also increase the risk of dementia.
Yep.
Smoking, obesity, diabetes, high cholesterol, and high blood pressure. These are all culprits.
Yes.
Heart disease and high blood pressure and diabetes can lead to stroke and blood vessel changes that can result in dementia.
Yep. And we see it a lot. Managing. So if you have diabetes or a heart condition, it doesn't mean that you're going to have dementia, right? Like there are diseases that can be managed in many ways. And so staying on top of your, like if you take maybe a preventative aspirin a day, or you really monitor your blood sugar levels. You stay away from sweets and things that will spike your glucose. paying attention to those things, monitoring them to keep them under control, and then you're less likely to develop mild cognitive impairment or dementia or
it's
memory
lowering
loss.
that risk,
Yep.
right? I mean, we want to lower the risk as much as we possibly can.
Right.
And like you said, it can just be little things. It doesn't have to be changing over to a full-on Mediterranean diet.
Right.
It could be
Right.
just incorporating some extra fruits and vegetables.
Right.
Or maybe not doing the afternoon coffee with sugar.
Right.
But I don't think yours has sugar. I know you too well.
Sugar. You know me well. Yeah. I mean, but that's like a great example. So for me, sugar, I was like, all right, I have diabetes in my family, both type 1, type 2. I'm lucky that I'm more of a savory person, but I'm like, you know what? I can do without the processed sugar. And so on occasion, I'll get an ice cream or have some Skittles. But for the most part, day to day, I stay away from it. And that was like an easy, low-hanging sort of lifestyle change that I could make. I'm really working on drinking more water because that's a place where I really struggle. But you're right. Like, just pick one or two things, like exercise. You know, it doesn't, like you said, it doesn't have to be a marathon. And we'll get into that a little bit more. But we know exercise, like doctors have said, if I could prescribe one thing, that it would be exercise. If I could bottle it up, it would be exercise.
Well, if you think about it, I think we've said this before. No one goes on a beautiful walk on a nice day and comes back and says, I feel lousy.
Right.
You know, when you take time to do these things, you typically feel well, and it does have an impact on not just your overall health, but I think your mental health as well.
For sure. I've never regretted doing exercise, never regretted a walk on a nice day, never regretted a workout, even though it's hard. About 50, like if I'm 10 minutes into a 20-minute workout, I'm happy I did it.
Yep.
I moan and groan for the first 5 minutes, and then I said, wow, I'm really happy I did this. You get the endorphins going, you feel great, your mental health is better. And we know it's one of the best things you can do for your overall health and wellness.
So you got your exercise, your nutrition. We're going to talk a little bit more about sleep. But I also think overall health and behavior factors, thinking about cognitively stimulating yourself.
Yep.
And people say, well, how the heck do I cognitively stimulate myself? There are so many ways that you can do this. And yeah, it's great if you do the crossword puzzle in your newspaper every day, or you got your favorite word search book. That's all great. You can continue to do those things, but why not try something that you've never tried before, or try to challenge yourself? That's the key.
Yeah. Yep. Something unique for you, whether it's an instrument or language. And it doesn't mean you have to master it. It's getting your brain to spend time on something unusual for your own brain, and something hopefully enjoyable. Wordle is great, but Wordle every day, I mean, it's only going to stimulate you so much. But if you do that on a daily basis, and then, every couple of weeks you try something new, you try Mahjong, or you read an article in a magazine that's different from what you normally read, maybe a science magazine, something that's getting your brain to think in different ways.
And it doesn't always have to be trivial either, reading and trying to, challenge your cognitive ability is great, but I also think that you can cognitively stimulate yourself by learning a new dance.
Yeah.
Or like you said, a new instrument, maybe even just listening to a different type of genre of music that you don't typically listen to.
Right. Head to the opera.
Yeah, there's so many
Stretch your
different ways. Try something new. And not only will it stimulate you, but I think that all of the things that we just talked about really do, coincide with mental well-being.
Yeah.
And mental well-being does affect your overall health.
Right. And then also community. So if you can find something like pickleball, obviously has like swept the country. It's so popular. But one of the great side effects, or like sort of silver linings of it, is that it creates community. So yes, you get maybe some outdoor time if it's your courts are outdoors. Yes, you get the physical activity, but now you have a pickleball community. Yeah. Now you have people that say, oh, where's Erica? It's 2:00. She should be here. We're ready to play. That's now your community. And so now you have like shared, you laugh.
Well, no, I'm laughing because I'm like, yeah, that would be my community. And the next thing you know, I would be shopping and we'd have matching pickleball rackets and outfits, and it would become a whole thing.
Let's do it. I say let's do it.
But, there's so many different, opportunities out there. They're not just at the senior centers. They're at the libraries, the community centers. centers. I mean, if you have a phone, most people have social media, Facebook. Try to look up something new that's happening in your community.
Yeah, I love that. It's so important and helpful.
So that kind of brings us over to sleep and brain health, Erica. And you do a great job at talking about the importance of sleep.
Sleep. I'm just seeing where I am here. Here we go. So we're learning so much about how important sleep is. So setting the right tone for your evening is important. So we know a walk after dinner is great. The nice weather's coming. Depending
God.
on when you're seeing this podcast, but or hearing it, but the good weather's coming. A nice walk after dinner. Having a window of no screen time for those of us that are more attached to our screens. Getting away from the screen the last hour or two before bed is a great habit. Reading is a great habit before bed. Sometimes people take a warm shower, a warm bath before bed, some herbal tea. Definitely like starting to chill. I either don't have coffee after 4 o'clock or I switch to decaf. And because I'm pretty sensitive to caffeine, really thinking about getting your body ready to relax for the evening. So doing that, getting a good night's sleep, making sure that any medication, some of the B complex medications actually are stimulating. So you want to make sure you're taking those in the morning. Talk to your doctor. Obviously, I'm not a doctor. I just like to pretend I'm one. So making sure that your medications aren't interrupting your sleep. Setting a nice mood. Your room should be dark. It should be cool. Everybody's a little different, but your room should be fairly cool. Getting a good night's sleep. And if you're able to wake up naturally, not setting the snooze. We know the snooze is not great. To do snooze. Better to set your alarm 30 minutes later than to snooze all morning. It's just interrupted sleep. If you're having trouble sleeping through the night, which as we age, we have a lot more bathroom trips at night. So maybe drinking heavy, do your hydration earlier in the day, slow it down later in the day. But as we age, we're getting up more in the night. So trying to limit liquids after, 6 or 7 o'clock. But we know that sleep is important. Sleep apnea, which are pauses in our breathing, we know can lead to stroke, high blood pressure, poor overall health. That affects our brains. So if you have sleep apnea, if you're snoring, or if you realize you wake up and you're sort of short of breath, it could be a sign that you have sleep apnea. You should definitely talk to your doctor. There are now apps and machines and all sorts of things to treat it.
The Calm app. And I mean, everything you're sharing, Erica, it's you can actually Google sleep hygiene, and it's a real thing. I mean, as you're sharing, many of these things are creating kind of that evening routine, and routine is so helpful. And everyone's way of finding a sleep hygiene that works for them is going to be different for everyone. So I suggest Googling that and seeing what you can incorporate to help you.
What works for you?
Because when you're sleeping, it's not just about feeling rested, but when you're in that deep sleep, your brain is actually releasing toxins that do build up during the daytime hours when you're awake. So, not getting adequate sleep, you're not getting those toxins
You're not
flushed
getting
out.
the clean out. Right. And another, also what's happening in your brain is you're storing away memories and things that happen during the day. You're sort of like, it's your housekeeping. And so when you're not getting that sleep, especially midlife, and I tell, I'm in my 50s now. I know you get a little ways to go, Sarah, but I tell my friends and family, this is key time to really clean up your sleep, because this is laying the foundation for healthy aging. So the younger you can get this sleep, if you're raising kids, we know it's hard to get a good night's sleep. So your kids hit a certain age, or they're grown and they're leaving the house. This is when you can really get some prime sleep, and it's laying the foundation for your aging. It's cleaning out your systems at night, cleaning out your brain, and also storing your information, cleaning house, getting your file cabinets all in order so that things can be retrieved when you need them. Getting rid of the things you don't need to remember, storing away the things that we need to remember that help us survive, and cleaning house of our brain. And it's getting more and more clear how important sleep is for our wellness overall.
It's downsizing our health.
Yes, it is. I like that. That's a new one.
But anyhow, I mean, so all of these are great suggestions for sleep, Erica. Thank you so much.
Of course.
And, our next topic is something that is right up your alley, too, because it talks about healthy diet and brain health. And, we hear so much about diet and how it can, what do they say? You are what you eat.
Yeah.
And, I don't think that, eating does not just affect us and our size and shape, but it also affects us internally.
Yeah.
And it's not just about, being heavier. It's also about thinking clearer and being able to have good gut health
Right.
and feeling healthy.
Feeling good. Yeah.
It's all connected.
It's true. And we've talked about this so much. Like, Michael Pollan has a fantastic saying. I think it's Michael Pollan, so forgive me if it's not, but it's eat real food, mostly plants, not too much. It's being mindful of what we're eating. And for us, convenience has sort of led us down like a dark road for food. And so when we are financially able, physically able to get fresh, whole, organic foods, we're lucky, and we should be mindful of what we're eating. And, they talk about the 80%, eating healthy 80% of the time, having a nice big salad and really filling up on the healthier, real foods, but really sticking to like, is this a real food that my grandparents would recognize? Is it good? Is it going to help me or is it going to hurt me? And just being mindful as we're eating, like, is this good for me? And not everybody has that. There are places that, people don't have access to good, healthy food. But if you do, if you live in a place where you have, we're in Westford, there are like farmers markets, there's decent grocery stores where you have that kind of access, like really focusing the first part of your meal on those, like a nice a vegetable or some fruit, some berries. And then limiting the more entertaining foods, the Doritos, which I don't even know if you can literally call that a food, but limiting the more enjoyable foods that are more like entertainment, food as entertainment,
Absolutely.
and comfort. But the more you do it, and I think we've talked about this before, the more you enjoy the better foods, the better they taste, and the more excited you are about eating the healthier stuff.
Absolutely. And, you said a quote earlier, and something reminded me of something that someone once said to me. Some people will say, oh, well, buying the fresh food can be a little more expensive than buying it processed. And someone said to me, well, you're going to pay for it at some point. You're either going to pay for it up front or you're going to pay for it on the back end with your medical bills.
I love that. It's
and
true.
if you think about it, it's an investment. You're
Right.
investing in yourself to eat healthier, and it really, in the long run, those things do catch up to you.
It's true. And, it's so funny, like, when you're in the line at the grocery store and you're checking out and you have this large grocery bill and you're sort of like, I kind of complain about it. But then I'm like, what's more important than the food that I'm putting, in my body and in my family's body and my friends, if I'm hosting friends? It's like, there's actually nothing more important to spend money on because you're consuming it.
Exactly.
And we complain about food prices, but really nothing's more important than fresh food.
Exactly.
For survival and for wellness. And so, I'll pay money for, music or clothing, a brand, but then I complain about food. It's like, I agree with you. Like, that is so important to put the money there to, like, if you have, if you can, yes. And then controlling, there's I think it's Japanese folks culturally have, there's like a phrase for it, but like stopping eating when you're 80% full, you're almost full, and stopping then, because it takes a little while for your brain to catch up. And this is something that takes mindfulness, but so some people have been out to eat with people and they say, oh, can you wrap half of this before I begin eating? So they aren't going to consume this American-sized portion. They cut it ahead of time and they say, okay, I'm going to enjoy this. And if I'm relatively full, I'm going to stop eating and wait. And if you can wait 10 or 15 minutes, usually you're full. So really, like, that real food, mostly plants, and then the not too much is kind of being mindful. Am I full? It feels good to eat, but I probably don't need any. When you're just starving. Oh, I'm so hungry. I'm so hungry. And then you're like, oh, 15 minutes later, you're like, oh, I'm so full. Like, you don't want to get to that point.
No, you don't. And I think, again, it's coming up with that routine, right? And once you kind of have a routine and you're being more aware of what you're putting in your body and being aware of how full you are, you start to create better, healthier routines and habits.
Right.
And sometimes it just starts by just writing down what you're eating during the day and becoming more aware of what it is that you're eating. And then you get to the end of the day and you're like, yeah, I don't really think I need that bowl of popcorn.
Right. When you see what you ate.
When you look at the list of things you've had all day.
And that is so, I'm glad you mentioned the food journal, because I think that has been recommended quite a bit.
Yeah.
It's important.
So we have a few minutes here, so I just kind of want to breeze through. I mean, we've talked about so many ways. I mean, really, besides having a healthy diet, the last two things that we can briefly, talk about is really just how can we get more active. It doesn't, again, have to be, they recommend 150 minutes a week, which sounds like a lot, but when you break it down, it's really 30 minutes a day. And that 30 minutes a day does not have to happen all at once.
Totally.
It can be broken down to 5 or 10 minute increments. It's do what you can, but don't do not anything at all.
Right.
And, it doesn't have to be, a Pilates or, step aerobics. It could be something as simple as gardening or dancing or even a sport that you might like golf or pickleball.
Or I know a lot of people now are trying to exercise during commercial breaks. If you're watching Hulu and you don't have the upgraded version, you get up and do commercial breaks. Oh.
But there's even great hobbies out there that you could try. It could be knitting or crocheting. Those diamond arts are getting popular. Yep. But there's so many hobbies out there that can boost your brain and just trying something new.
It's true.
But other than that, I mean, other ways, I know meditation is a big one.
Yep.
Meditation and really just, again, mental well-being, being mindful.
Present.
There's some really great apps out there that you can download. I know a lot of people like that Calm app.
Yep.
There's some free apps and some paid apps. It's worth trying a few to see if there's something that can get you to...
YouTube has some great ones. You can put in 5-minute meditation, 10-minute meditation, so...
And then, we'll leave it off on community because there is so much benefit to community. I think that when you're involved in your greater community, you're hitting all of the things that we talked about. You're getting socially engaged. You're getting out and about. So you're getting physical. You're trying maybe something new. You're engaging in conversation. And it doesn't have to be the senior center. It doesn't have to be the library. Maybe there's a volunteer opportunity out there. So not only are you doing good and helping the world and making a difference, but you're stimulating yourself. So
I love it.
Take time to just research different ways that you can get out in your community and more involved. But this was, a lot to cover in a short time.
Some went by fast. We could talk forever on this.
But like Erica said, hopefully by listening to this, you're maybe taking one small thing that you can incorporate into your life, and hopefully it will make a small difference.
Fantastic. Well, thank you, Sarah.
Thank you.
You've been a great guest.
Well, you have been too. So we thank everyone for joining in and listening in to Bridges to Community. Until the next time, take care.